Hi, I'm Ume. Before we start, please subscribe to our channel so the next time you'll be updated with our new releases. Hello everyone! Who doesn't dream of a beautiful pair of eyes? Some people even do some surgeries to enhance their eye appearance. Besides appearance, some people dream of seeing the world clearly every day when they wake up. They wish they could open their eyes in the swimming pool and see clearly. Some people want to jog someday or play with their kids or dogs without worrying about their glasses or contact lenses. But science is always there to help improve our lives and make them easier for us. And that's why there is now the option of laser vision correction. You can totally live without eyeglasses or contact lenses forever. So have you heard about laser vision correction? Or let me say LASIK vision correction. You might have heard about it, or you might have a relative or a close friend who already did it. Today we'll talk about laser vision correction and how it can fix many vision problems. We have Doctor Choi, who is a leading doctor at B VIIT Eye Center in Seoul. She's going to discuss with us everything about laser vision correction from an experienced medical point of view. So, if you are interested, just keep on watching to learn more. Hi, doctor. Nice to meet you.
Nice to meet you.
Can you please introduce yourself a little bit?
Hi, this is Dr. Choi. I'm from Korea, obviously, and I work for B VIIT Eye Center, which is one of the most great visual correction center in Korea.
All right. So moving on to the first question. So what is exactly laser vision correction?
I would say it's generally known as LASIK or LASIK surgery for general population. Simply makes you can see the world without glasses or contact lenses as you like you're to be wearing them. But long times ago, it started with LASIK or LASIK surgeries, but now it's there's more option for people, like small surgery, the recent one, and the topography guided surgery, which enables you to get more personalized and customized and individualized surgery.
Okay, perfect. So in what cases will vision correction really help restore the vision?
I would say anybody who wants to take off their glasses or not wanting to wear contact lenses every day. But anybody who wants to go sport without glasses, or anybody who wants to be look pretty or handsome without glasses, anybody can be candidates.
So are there any specific indications for the surgery?
Medically speaking, the most important is, I would say, age. Age who would be over 18 are good candidates, and who stop progressing of myopia or astigmatism, which is actually age of 14. But to be more safe, doctors like to proceed on them after age of 18.
All right. So talking about age, what is the perfect age in your opinion to have laser vision correction?
I would say if you're after age 18, the sooner the better. Because when you get the surgery, it's not like the surgery has a expiration date, but once you get the surgery, then you can live without glasses the longer.
So is there any contraindications for the procedure?
Again, medically speaking, there is very strict 2 contraindications for the surgery. The first one is ectatic cornea, which means the cornea is progressively coming front. And the second one is called avelino-dystrophy, which is genetic condition. To screen all these very important contraindication, the cases, you need to get very thorough checkup before you get the surgery.
Okay, so in the case of a surgery, the patient, how can a patient prepare for the laser surgery?
So there's not actually very important thing you should do before you come to the hospital, but I would tell my friends or my people who want to get the surgery, I would tell them just get a very good night's sleep before come to the hospital, because if you don't sleep good night, then your eyes can get a little dry, and the test result might not get very clear. And it can, like, you know, to get the very good surgery result, it's very important that you have those clear test results.
How is the surgery done? What exactly is done during the surgery?
So during the surgery, a lot of people might be very curious about it. So if you walk in the OR, there's going to be the pre-op preparation room, and there you're going to get assisted with the nurses and other help with eye drops that can, like, numb your eyes during the surgery, and, like, to sterilize all your, like, surgical field, which means the both of your eyes and, like, between your eyes and, like, around your eyes. And you'll get that, and you'll see the doctor, and, like, just a very brief checkup before the surgery, and then it will take probably 10 to 15 minutes. And after you actually lie on the surgical table, it's only gonna take like another 10 or 15 minutes, more or less. And during the surgery, I think all you're gonna remember is look at the, like, blinking lights, like sometimes red light, sometimes a green light. Just follow the, like, instruction as what doctor asks you to do. You're not gonna feel any pain at all if you don't, like, try to squeeze it too hard, or like you're too, like, afraid and you can, like, squeeze your feet too hard. Sometimes patients get, like, little bleed in their hands, but it's not the actually surgery itself, it's not painful at all. So just keep that in mind. It's not painful at all. It's gonna be like 10, 15 minutes, more or less. And after the surgery, you're gonna go to recovery room and get some eye drops to reduce your, like, discomfort, and make sure that the surgery went all right. And then you can go home. The whole procedure will probably take less than an hour.
So after the surgery, there's no time you should spend in the clinic, right? You can just leave.
You can leave after, like, couple, like, 10, 15 minutes of recovery time.
How about physical activities? Can you do any sports or such a thing after surgery?
Depending on, like, surgeries you've done, you can do the light sports from the next day, like small LASIK surgery. But if you get the regular LASIK surgery, you might want to wait for at least, like, a couple weeks to start doing your light workout.
So, talking about female patients, they ask a lot about pregnancy. And if they should wait after the surgery to get pregnancy, or they should get pregnant before the surgery. So what do you think about it?
If you're not pregnant at the point that when you're getting the surgery, before or after the surgery, it's not very important factor to decide when you get the surgery. So at the point, if you're pregnant, I wouldn't recommend you to get, like, surgery. But if you are before the pregnancy or after pregnancy, it's not so important.
So when we talk about laser vision correction, there are many words that come out, like SMILE, LASIK, LASIK. What is it exactly the difference?
Oh, it's to make sure that you understand all that. It's gonna probably take more than, like, hour or 2 hours. So let me so when I explain to my patients in an easy and simple way, there's, like, 2 categories that you should keep in mind when you decide what kind of surgery you want to get. So first one is about the safety of the surgery. So among 3 surgeries, I would say if you want a very safe and stable surgery, then you might want to get, like, SMILE surgery or LASIK surgery with the E. And the second category that you should keep in mind is how much recovery time you can spend after the surgery. So if you have to go back to everyday life right after the surgery, you might want to get the LASIK surgery with the I and the, like, SMILE surgery. Like, LASIK surgery with the E can be pretty painful for first couple days. Take quite amount of time to get full recovery of the vision. So it's going to be at least a month or two. So you need to think about it before the surgery. Small LASIK, I would say, is the most recent technology-wise based and added the feature what's lack in LASIK surgery. So LASIK surgery is said to be very convenient in terms of fast recovery and painless surgery. But the only problem with that LASIK surgery is that it makes a flap on the cornea. So that can damage the safety and stability of the cornea. When you get the small surgery, the size of the incision is less than like 1/4 of the LASIK flap incision. And this is how the small surgery can provide higher stability and safety of the cornea after the surgery. So it sounds like small surgery is the best of all kinds, but it is just generally speaking that I said. With a certain eyes, small surgery is not suitable. For example, like eyes with high astigmatism and hyperopia and some cornea with asymmetric cornea shape. Those are not suitable for the small surgery. So knowing all these pros and cons, you can choose a surgery that's most suitable for you. And the clinic will give you the option that you can choose. Also provide what kind of surgery is the best fit for you.
So it really depends on the patient, right? So last question. What is the side effects of a laser vision correction?
Laser vision correction surgery. Yeah. So there's always, as I said, pros and cons when you get the medical procedure or the surgery. Most common complaints after the surgery is dry eye and the glare. If you get any eye surgeries, including LASIK surgery, or like glaucoma surgery, cataract surgery, any kind of eye surgeries, you will have a dry eye for like 6 months to 1 year.
Wow, it's a long time.
Yeah, so during that period of time, I'd recommend to use artificial tears, even though you don't feel the dry eye. And same with the glare. It will go away step by step as time goes, mostly within a year.
Okay, it's very clear. Thank you, doctor, for your time.
Sure.
Laser vision correction allows people to see the world without glasses or contacts. While many are aware of LASIK, now there are advancements to the technology making them more appealing, such as smile surgery. While there are a few exceptions, anyone 18 and over who wishes to take off their glasses or contacts, do sports, or simply wants to improve their look are able to get laser vision correction. There are several techniques in laser vision correction. LASIK, LASIK, and SMILE are three of the most popular laser methods to achieve vision correction. LASIK has the benefit of being pain-free and a quick recovery period. SMILE improves upon the benefits of LASIK by only leaving a tiny flap relative to LASIK, increasing stability and safety. LASIK is ideal for people with thin cornea. The disadvantages are that it is a painful procedure and the recovery time is much longer than LASIK or SMILE. The advantage is that no flap is created, limiting the possibility of scarring of the cornea. The laser vision correction surgeries take less than an hour to complete. With the exception of for LASIK, the procedures offer the convenience of very quick recovery. You can go back to normal life right afterwards. For LASIK, it is painful for a few days after surgeries and recovery takes weeks or months before fully returning to normal life. It is normal to have dry eyes after the surgery. It is recommended one uses artificial tears to remedy the condition for 6 months or more, as needed. Finally, it is important to get a good night rest prior to the day of the surgery, as exhaustion or tiredness can dry the eye and the diagnostic test results can become less accurate. Thank you for joining us once again today at CloudHospital TV. If you have any questions or comments, please leave them below and we'll respond to you as soon as possible.